It's a Tuesday morning, you pour your coffee, you sit down at the kitchen table, and you open your bank statement to check your Social Security deposit. But something is wrong. The number is smaller than last month. Not by a little, by a lot. You think it's a mistake, you check again. Same number? Then you open a letter from Social Security. It says your Medicare Part B premium has increased, and the new amount has already been taken out of your check. Nobody warned you. Nobody called. Nobody asked your permission. You didn't spend that money. You didn't authorize a withdrawal, but it's gone. And for millions of American seniors right now, this is not a hypothetical. This is happening right now. In 2026, if that scenario scared you, I'm glad, because it should. And that is exactly why I made this video. I am Milena. I am a senior policy analyst, and I specialize in helping retirees understand complicated government rules before those rules take money out of their pockets. Today, I'm going to walk you through exactly what is happening with Medicare premiums in 2026. I'm going to explain a congressional report that just exposed how American seniors have been overpaying billions of dollars. And I'm going to show you the specific government forms and programs that can protect your benefits starting today. But I need you to do one thing for me. Stay until the end of this video, because at the 8-minute mark, I'm going to share a hidden mistake that catches thousands of retirees every single year. It's a mistake that can silently drain your Social Security check month after month, and most people don't even know it's happening until it's too late. Let's start with a story. Robert is 67 years old. He lives in Indiana. He retired 2 years ago after working 35 years as an electrician. Robert did a lot of things right. He paid into Social Security his whole career. He signed up for Medicare Part B the month he turned 65. He chose a Medigap Plan G to cover what Medicare doesn't. And he kept his expenses modest. When Robert heard that Social Security was giving a 2.8% cost of living adjustment for 2026, he felt good. That meant about $56 more every month. Not a fortune, but enough to help. Then January came. Robert checked his deposit. And instead of going up by $56, his check had only gone up by about $38. He called Social Security. They told him that his Medicare Part B premium had increased by $17.90 per month. That money was automatically deducted before his check was deposited. Robert thought, okay, that's frustrating, but manageable. Then he got a second surprise. His Medigap Plan G premium had gone up too. Not by a little, by 40%. His monthly supplement payment went from $140 to nearly $180. And then came the real blow. Robert had sold a small rental property in 2024 to pay off some debt. That sale pushed his income above $109,000 for that tax year. And because Social Security uses your tax return from 2 years ago, that one-time spike in income triggered something called IRMAA, an income-related monthly adjustment amount. Suddenly, Robert wasn't paying $202.90 for Part B. He was paying $284.10, an extra $81.20 every single month, taken directly from his Social Security check. Nobody told Robert this would happen. He didn't know about the 2-year look back. He didn't know about the income cliff, and he didn't know there was a government form he could have filed to fight it. Robert lost $974.40 in 1 year because of one rule he didn't know existed. Robert's story is not unusual. It's happening to seniors across the country right now, and today I'm going to make sure it does not happen to you. Let's go through exactly what is happening with Medicare costs in 2026. Everything I'm about to share with you comes directly from official government sources. No rumors, no guesswork. Fact number 1. Your Part B premium went up almost 10%. The standard Medicare Part B premium for 2026 is $202.90 per month. That is up from $185 in 2025. That's a $17.90 increase, almost a 10% jump in 1 year. This is confirmed on the official Social Security website, ssa.gov. It's confirmed on medicare.gov, and it's confirmed in the official 2026 Medicare Costs Fact Sheet, publication 11/79. On top of that, you still have to pay the Part B annual deductible of $283 before Medicare starts covering outpatient services. Fact number 2. Your Social Security raise is being eaten alive. Social Security announced a 2.8% cost of living adjustment for 2026. For the average retired worker, that adds about $56 a month. Your check goes from $2,015 to $2,071. That sounds like good news. Until you realize that nearly $18 of that raise goes straight to the Part B premium increase. And that's just Part B. You still have Part D drug plan premiums, Medigap supplement premiums, copays, deductibles. The Boston College Center for Retirement Research found that the Part B premium alone now eats up over 25% of the entire COLA increase. And here's the number that should really get your attention. Part B premiums, as a share of the average Social Security benefit, have reached an all-time high of 9.4%. That has never been higher in the history of the Medicare program. For the median retiree, after all medical out-of-pocket costs, only 71% of your Social Security check is left for everything else. For lower-income retirees, it's only 52%. Fact number 3. A congressional report just exposed that you are overpaying. And it's not your fault. On March 11, 2026, the Joint Economic Committee, a bipartisan group of lawmakers, released a report that found something shocking. In 2025, the federal government paid Medicare Advantage insurance companies up to $84 billion more than it would have cost to cover those same people under traditional Medicare. Let me say that again. $84 billion in overpayments to private insurance companies. And here's the part that directly hurts your wallet. Those overpayments pushed up the Part B premiums that every single Medicare beneficiary pays. The report estimated that in 2025 alone, every senior paid an extra $212 in higher premiums because of these overpayments. That's $13.4 billion taken from seniors collectively. The Kaiser Family Foundation broke down where that $84 billion went. About $40 billion came from something called coding intensity. That means insurance companies were documenting more medical diagnoses on paper to trigger higher government payments, and about $44 billion came from what's called favorable selection. Healthier people tend to join Medicare Advantage plans, but the government still pays the plans as if those members were sicker. And the worst part? If nothing changes, the report projects that annual per-person Medicare premiums will rise from about $2,440 today to roughly $5,000 by 2035. That is a doubling of your premiums in less than 10 years. Fact number 4. IRMAA, the hidden surcharge that catches retirees off guard. Now let me explain the rule that caught Robert. It's called IRMAA, Income-Related Monthly Adjustment Amount. If your modified adjusted gross income, or MAGI, is above a certain level, Medicare charges you a surcharge on top of the standard Part B premium and on top of your Part D drug plan premium too. For 2026, here is how it works. If you're single and your income is $109,000 or less, you pay the standard $202.90 per month. But the moment your income crosses $109,001, your premium jumps to $284.10. That is an extra $81.20 per month, or $974.40 per year. And it gets steeper from there. At the highest tier, individuals earning $500,000 or more pay $689.90 per month for Part B alone. Here's the critical detail most people miss. Social Security doesn't use this year's income to determine IRMAA. They use your tax return from 2 years ago. So your 2024 tax return is what determines your 2026 premiums. That means if you sold a house in 2024, cashed out an IRA, did a large Roth conversion, or received a pension lump sum, that one-time income spike could push you into a higher IRMAA bracket right now. And the increase is deducted automatically from your Social Security check. There is no gradual phase-in. There is no warning phone call. It just happens. Fact number 5, late enrollment penalties last forever. If you delayed signing up for Part B when you were first eligible and you didn't have qualifying employer coverage, you face a penalty of 10% for every full 12-month period you were late. And this penalty is not a one-time fee. It is added to your monthly premium for as long as you have Part B. That means for the rest of your life. A 2-year delay means a 20% permanent surcharge. Instead of $202.90 a month, you pay $243.50 every month forever. Part D has a similar penalty, 1% per month, 12% per year. Also permanent. Now, you understand the rules, you understand the risks. Here is exactly what you need to do. 3 steps, all free, all based on official government programs. Step 1, check if you qualify for a Medicare savings program. There are 4 programs that can help pay your Medicare premiums, deductibles, and copays. The most comprehensive is called the QMB program. If you're single and your monthly income is $1,350 or less, and your resources are under $9,950, you may qualify to have your Part A and Part B premiums, deductibles, coinsurance, and copays all covered. Even if you earn a bit more, the SLMB and QI programs can cover your Part B premium if your monthly income is under $1,616 or $1,816. Here's the thing. Millions of seniors who qualify for these programs never apply. That means they're paying thousands of dollars a year that they don't have to pay. Go to Medicare.gov and search for Medicare savings programs, or call 1-800-MEDICARE. That number is 1-800-633-4227. And here's an important detail. The QI program requires you to reapply every single year. It's first come, first served. If you miss the window, you lose a full year of savings. Do not wait. Step 2. If you were hit by IRMAA and your income has dropped, file Form SSA 44 immediately. If you experienced a life-changing event that reduced your income, like retiring, losing a spouse, getting divorced, losing pension income, or even losing property in a disaster, you have the right to ask Social Security to use a more recent year's income instead of the 2-year-old tax return. The form is called SSA 44. You can download it at ssa.gov. You can file it online, by mail, or in person at your local Social Security office. The phone number is 1-800-772-1213. This is the form Robert didn't know about. If he had filed it after he retired and his income dropped, he could have gone back to paying the standard premium. That would have saved him nearly $1,000 in just 1 year. If you disagree with your IRMAA determination for any reason, you also have the legal right to appeal using Form SSA 561U2. Don't accept a higher premium without checking your options first. Step 3. Contact your state SHIP program for free Medicare counseling. Every single state has a program called SHIP. It stands for State Health Insurance Assistance Program. These are trained counselors who will sit down with you for free and help you understand your Medicare options, compare plans, check if you qualify for savings programs, and review your premium situation. This is not a sales pitch. These counselors don't sell insurance. They work for you. You can find your local SHIP by calling 1-800-MEDICARE or by looking in the back of your Medicare and You Handbook. Now, I want to talk to you about something that really matters to me. Everything I just told you in this video, these are rules that change every single year. IRMAA brackets change. Premium amounts change. Savings program income limits change. Enrollment deadlines come and go. And here is the problem. You cannot rely on YouTube notifications to keep you informed. The algorithm decides what you see, not you. That means you might miss the next critical update that affects your Social Security check, your Medicare coverage, or your retirement savings. That is exactly why I created the Global Senior Alerts official WhatsApp channel. When you join, you will be able to download a free senior benefits protection guide. It covers Social Security rules, Medicare traps, pension protections, banking regulations, insurance claim tips, and travel rules for seniors, all in one place, written in plain, simple language. You will also receive real-time alerts whenever a new rule, deadline, or government change is announced that could affect your benefits. No spam, no selling, just the information you need to protect what you've earned. The link is right there in the description below this video. Click it. Join the channel. Download the free guide. It takes 30 seconds and it could save you thousands of dollars. And one last thing. If you found this video helpful, I need your help too. Hit that subscribe button. Tap the bell so you never miss an upload. And share this video with someone you love. Your spouse, your parents, your neighbor, a friend from church, anyone over 55 who depends on Social Security or Medicare. Because the rules are changing, the premiums are rising, and the only way to protect yourself is to know exactly what's happening before it hits your bank account. I'm Milena. I'll see you in the next one. Stay informed, stay protected,